righty. So we have a lot of ground to cover, so I'm actually just going to get started. This is Hormones Decoded, an educational webinar, and my goal is really to break down the science of what is actually happening in your body, strip away the confusing marketing, and give you clear, actionable steps to reclaim your vitality. So let's dive in. So I'm going to officially welcome you to the Hormones Decoded. It's an educational webinar with me. I'm Dr. Michelle Gilliatte. I am the founder of SomaVie Wellness Center and Med Spa, and I am double board certified in obesity medicine and family medicine. You can also find us on Instagram at SomaVie Wellness. We share on Instagram, we share a lot of ongoing tips, educational content, and updates on our clinic. So this webinar was really born out of a real passion in my clinical practice. Every single day, I see patients who are exhausted, they're struggling with weight gain, they've got brain fog or mood swings, and they are repeatedly told that their laboratory tests are completely normal or that they are just getting older. And today, we're going to talk about why those normal reference ranges might be missing the full story, and how we can work together to find the actual root cause of those symptoms. So the agenda for today. So here's what we're going to cover. So we've broken this webinar into 6 different distinct sections. There's hormones, which is the root of everything. We'll look at the 3 primary chemical messengers that do the heavy lifting. We'll look at imbalances in men and women. We'll look at both sides of the coin. Hormonal transitions look very different for everyone. So we'll detail the specific pathways for both female perimenopause and menopause and male andropause, and how we correct it. This is where we talk about root cause, clinical care, including advanced testing, targeted supplementation, hormonal replacement therapy, all of those things. Biote pellet therapy, we do a lot of Biote pellet therapy here. We'll talk about SomaVie's offerings for those who want to take the next step with us. I've curated 3 exclusive wellness packages for webinar attendees today. And we'll do a little quick Q&A that I will stay on at the very end and answer those questions live. All right, so the root of everything. So let's start by defining what we are working with. Hormones are your body's chemical messengers. They travel through your bloodstream to tissues and organs. They control virtually everything from your metabolism and mood to reproduction and sleep. While there are dozens of hormones in the body, 3 major sex hormones do the absolute heaviest lifting when it comes to how you feel on a daily basis. Testosterone, so most people think of this strictly as a male hormone, but women make and need it too. Testosterone is vital for maintaining physical energy, building and protecting lean muscle mass, stabilizing mood, supporting libido, which most people know, and keeping your metabolism firing. Progesterone, think of progesterone as your body's like natural Valium. It is the chemical messenger that promotes deep, calm, like protected sleep quality and regulates the menstrual cycle. And estrogen supports your mood, protects your skin's elasticity, and preserves bone density, and plays a major, major role in cardiovascular health. But these 3 powerhouses don't operate in a small vacuum. They rely on important supporting casts such as like cortisol and thyroid. And your cortisol, which is known as like your stress hormone, when your stress is like chronically high, cortisol spikes, which directly impacts your cholesterol levels, blood pressure, blood sugar, and your triglycerides. Thyroid, your master metabolic hormone, it plays a super pivotal role in regulating your heart health, cholesterol, and also blood pressure. So when one of these hormones is out of alignment, it creates a domino effect. And if your stress hormone cortisol is continuously like screaming, like continuously high, it will actively hijack your progesterone, your thyroid, and your estrogen. Everything in your body is connected. So we can't just replace one hormone, and we can't just look at one hormone. We have to look at the whole picture. And hopefully you understand that. Okay. So why do imbalances happen in the first place? It generally like boils down to three primary factors. So number one is aging. There's a natural hormone decline that occurs over time, of course. But what most people don't realize is that this decline doesn't wait until you're 60. It commonly begins in your 20s, actually. I have 30s on here, but actually testosterone starts to decline in your 20s or early 40s, and for some, even earlier. Second is going to be stress. Stress is a huge factor in our daily lives. Our modern lives are characterized by chronic low-grade stress. When you're constantly on the go, your body is continuously pumping out cortisol. This chronically high cortisol directly disrupts your body's natural delicate hormone cycle. The environment, and we're living in a chemical world. There's plastics everywhere. I've got a bag of nuts there in plastic. So everyday exposure to synthetic plastics, pesticides, and endocrine disrupting chemicals is now nearly universal, probably impossible to get away from. Most of us carry what we call a measurable body burden of these chemicals, which mimic or block our natural hormones. And how does this imbalance show up in your day-to-day life? You might recognize these symptoms because they're incredibly common, but not normal. So pervasive fatigue that sleep doesn't fix, unexplained weight gain, particularly stubborn fat around the midsection that doesn't budge despite diet and exercise, brain fog, feeling like you're moving through like molasses and forgetting, like you can't find the words, that kind of stuff, mood swings, and anxiety that feel kind of uncharacteristic. You're like, I'm not a super anxious person, right? But why am I anxious? And a decline in libido or sexual desire. A lot of people know that from testosterone decline. Poor sleep, waking up at 3 a.m. So if you're experiencing any or one, two, or three of these, your body is sending you a distress signal that's saying basically things are out of balance. So perimenopause and menopause for women. So now let's zoom into a little bit of women's hormonal health, starting with a critical distinction that is often misunderstood: perimenopause versus menopause. Many women come to my clinic in their early 40s feeling miserable. They say, my doctors ran a blood test and said I'm not in menopause yet, but they're experiencing classical perimenopause symptoms, which they may not be aware of. Perimenopause is the transition phase. It is diagnosed primarily by changes in your menstrual cycle, not by a single static blood test. It often begins in your late 30s to 40s, and during this stage, your hormone levels do not just steadily decline, they fluctuate. If I look at your hormones one day, it's like here. If I look at your estradiol here, it just goes like this. Very messy, like a roller coaster. So this unpredictable spiking and dropping is exactly what causes those intense mood swings up and down. And then you have heavy cycles and you have hot flashes because you're putting out so much estrogen. And then you're not putting out any. So it's up and down. Menopause, on the other hand, is a specific milestone. It's literally one day in your life. It is officially diagnosed only after you have gone 12 consecutive months without a period. So that day where you hit that 12-month mark is menopause. After that, it's postmenopause. So at this point, your hormone levels finally settle at a new lower baseline. But menopause is not like a light switch. It's not like, okay, I hit menopause and that's it. Everything's changing. The symptoms from that turbulent transition phase, that perimenopause, can continue well into postmenopause. I have patients who are in their 70s still having hot flashes because every once in a while your little ovaries will wake up and it'll put out a little bit of estrogen and they'll have hot flashes. So yes, that is actually common. All right. So symptoms. Let's look at the actual numbers when it comes to women's symptoms during this transition, the perimenopause. The data is super clear, yet these issues are really heavily swept under the rug. About 80% of women will experience hot flashes at some point during their transition. The median length of time those frequent hot flashes can persist is 7+ years, so sometimes 10 years, or if you're rare, in your 70s. That's 7 years of disrupted sleep, sudden sweating in meetings, physiological discomfort, fun times. 1 in 3 women notice increasing vaginal dryness after menopause, which severely impacts physical comfort and intimacy. This in itself can cause chronic UTIs as well. So if you're a woman who's postmenopausal getting multiple UTIs all of a sudden, probably not due to bacterial, it is a bacterial infection, but it's probably due to the dryness is changing your pH balance. Alongside this, women frequently battle fatigue, weight gain, especially in the midsection, brain fog, mood changes, sleep disruption, and low libido. And this statistic actually breaks my heart. Fewer than 4 in 10 women actually bring these symptoms up with a doctor. And why is that? Many women have been gaslit into believing that suffering is just part of being a woman. You know, it's fine. You're going through menopause, not a big deal. Or that they're just aging, right? No need to deal with it. You'll get over it. So I'm here to tell you that you do not have to live this way. There is real evidence-based relief, and we're going to talk about that. So the sex hormones. So to understand how we treat these hormones, we have to look at what these sex hormones actually do in the woman's body. Estrogen, this hormone is vital for regulating your mood, keeping skin hydrated and healthy, protecting bone density, managing temperature regulations, which is why when it goes down, it causes hot flashes, or when your estrogen declines, and supports heart health. Progesterone, this hormone is absolutely essential if you have a uterus because it balances estrogen's effects on the uterine lining, but it goes far beyond reproduction. Progesterone actually supports deep sleep and deep sleep quality, stabilizing mood, and plays a very key protective role in vascular and breast health. Testosterone, yes, women make testosterone too. In fact, we actually produce it in higher quantities than estrogen throughout our lives. It supports energy, mental drive, and libido. However, it's important to note that testosterone therapy in women is really only medically well supported for lower sex desire after menopause, or in general for lower sex desire. And I don't just treat a number. I'm usually looking at, hey, okay, do you have symptoms of low testosterone and is your number low? So here's a fascinating fact. Estrogen influences over 400 different functions throughout the female body. And it is far more than just a reproductive hormone. It affects your brain, your blood vessels, your bones, your metabolism. And this is exactly why hormonal balance doesn't just manifest as one symptom. It shows up in dozens of unrelated ways across our entire body. All right, thyroid and the cortisol connection. So we also have to talk a little bit about the master thyroid gland and our stress response. Thyroid issues are significantly more common in women and become increasingly frequent as we age. Because thyroid hormones regulate your cellular metabolism, thyroid dysfunction can perfectly mimic or severely worsen sex hormone imbalances. So you've probably scrolled through social media and read about adrenal fatigue. In the medical community, we want to be very clear. Adrenal fatigue is not actually a recognized medical diagnosis. However, chronically elevated cortisol is very real, specific, and testable medical condition. So this brings me to a major frustration. So why do normal laboratory tests miss our symptoms? The reference ranges used by standard labs are incredibly broad. They're designed to detect severe acute disease, not optimal health. Furthermore, timing matters immensely when testing hormones. And a single blood draw on a random Tuesday can miss your body's true hormonal patterns, especially if you're in perimenopause and you're going up and down, right? So that's why here at SomaVie, we take a different path. We don't just run basic standard blood tests. We test a lot more broadly. And we also use blood tests. Not only do we use blood tests, but we also oftentimes use additional testing like something called the Dutch test, which is a dried urine test for comprehensive hormones, which looks at the metabolites of your hormones as well, not just the actual hormone, how your hormones work in your body. And then we map out your physical symptoms, and we sit down to look at the entire picture together to determine what's truly optimal for you. Well, all right, so let's talk about andropause. Specifically, men's health, andropause, which is basically men's menopause, often referred to as male menopause. We treat men here as well. We actually have quite a few men that we treat with HRT here. It's not just a female site or a female office. We treat all sexes. So if you listen to late night radio or you scroll through the internet, you are inundated with advertisements telling every man over 35 they have low T and they need a quick fix prescription. So let's look at what the actual medical science tells us. Yes, testosterone levels do decline gradually with age in men and women. That part is absolutely real. However, age is usually not the biggest driver of low testosterone. The single largest risk factor for low testosterone in men is actually carrying extra weight and metabolic dysfunction. So let's look at the numbers from clinical research. There's nearly half of men with obesity have low testosterone compared to 1% of lean, healthy men of the same age. And this is a massive distinction. It means that weight and metabolic health are the largest levers we have to raise testosterone naturally, well before a prescription ever enters the conversation. True clinical low testosterone with matching biological symptoms is actually far less common than online marketing campaigns want you to believe. A single low lab value is a clue, but it's not the automatic diagnosis. It's not just like, okay, your testes aren't working anymore, so your testosterone's declining. We're going to look at the whole picture. That being said, when a man does experience clinical hormone drops, the symptoms heavily impact his quality of life. So common symptoms include chronically low energy and physical fatigue, a noticeable reduction in muscle mass paired with an increase in stubborn body fat, unexplained mood changes, irritability, mild depression, a decline in libido and performance, and trouble focusing or experiencing, similar to women when we have brain fog, the same thing. Hence the midlife crisis, right? All this stuff is going on when their testosterone is dropping. So this is because testosterone's biological role also extends far beyond just libido and sexual function. So testosterone is a critical hormone that supports muscle mass and overall physical strength, of course, bone mineral density, so osteoporosis, metabolic function and how your body distributes fat, mood stability, mental clarity, and the production of red blood cells. So because testosterone touches so many physiological symptoms, optimizing a man's metabolic health to naturally boost his levels or medically managing true deficiency can completely transform how he feels, performs, and ages. All right, so because hormones fluctuate so much based on stress, sleep, time of day, medical guidelines are very strict about how we diagnose low testosterone. Guidelines explicitly call for 2 separate morning blood tests on different days before diagnosing a man with actual true low testosterone. And its testosterone levels naturally peak early in the morning and then they decline throughout the day. So if we test you at 3 p.m. after a stressful work day, your levels will look naturally low, unnaturally low, I should say. But that's not really a true reflection of your baseline health. So put this in perspective, in one major clinical research study, over 51,000 men were screened for a low testosterone trial, but when the strict guidelines were applied, requiring proper symptoms and 2 separate validated morning tests, only about 1.5% of those men actually qualified for the diagnosis. So the bar for a true clinical diagnosis of just low testosterone is much higher than what online marketing leads you to believe. So that is why our first line of defense is almost always lifestyle optimization, focusing on targeted weight loss, metabolic health, and improved sleep quality. When medical treatment is appropriate, we build a very highly monitored, personalized plan around your entire physiological picture, not just a single lab number. And then we use various forms of testosterone replacement therapy to treat. All right. So the root cause care. So this brings us to how we do things differently here at SomaVie. We practice root cause care here. So if you go to a conventional clinic, you often get a 5-minute appointment and a basic blood panel. If your numbers fall anywhere inside that massive normal reference range, you're sent on your way. Your labs look normal, right? So at SomaVie, we use a 3-step methodology to find the actual root cause of your symptoms. We look at comprehensive labs. We run extensive advanced lab tests that look far beyond panels. We want to see your cardiovascular markers, metabolic health, vitamin levels, thyroid panels. We want to look at hormone cascade. We want to look at your iron, your ferritin, a lot of other components that contribute. B12 contributes to how you get rid of your hormones. Symptom mapping. So we always dive into your lifestyle, how much you drink, if you don't drink, are you stressed, are you not stressed, do you sleep, how's your digestion? So we look at the whole, and then we look at the whole picture evaluation, we put it all together. So our primary goal is really to find the deep root cause of why you feel the way you do, rather than simply just writing a prescription to mask your symptoms, because we can write a prescription to mask your symptoms, but you're really not going to have optimal health if we don't touch base onto the other things. All right. So treatment options, lots of them, a lot of them. Once we complete our 3-step evaluation, your comprehensive lab, your symptom map, your unique lifestyle, we sit down together and we choose from our clinical toolkit. The result is a personalized treatment plan designed specifically for your body and your life. That plan may include one of the several of the advanced medical modalities like HRT. When replacement is clinically indicated, safe, and appropriate, we offer multiple delivery methods tailored to just how your body absorbs hormones the best, or what works best for your lifestyle. With estradiol for women, we have transdermal patches, there's creams, there's gels, there's these thing called troches that you can dissolve under your tongue, small little like lozenges. And then we have bioidentical pellet therapy. For progesterone, this is for women with a uterus or women who are having trouble sleeping, because progesterone helps with sleep if you don't have a uterus. We use oral micronized progesterone capsules. You can also do vaginal suppositories. You can custom compound topical or vaginal formulations as well. But progesterone is really crucial to balance estrogen's effects on the uterine lining and also support deep sleep. Then testosterone options for men and select women. Traditional short-acting injections. We can do long-acting injections. Those are a little bit more stable, and those are going to be performed in our office. The short-acting injections you can do at home. They're usually 1 to 2 times a week. You can do modern oral capsules. Again, you can also do those troches. There's topical creams, there's gels, and we can do pellet therapy. And pellet therapy, we can combine the estradiol and the testosterone. Progesterone does not come in a pellet. There's alternative and natural testosterone enhancements for younger male patients or those who want to preserve fertility. We can actually stimulate your own hormone pathway instead of replacing them. So we can do this with enclomiphene or low-dose human chorionic gonadotropin injections, which signal your testes to make more of your own testosterone rather than just shutting down your natural production, which is what most exogenous or like outside testosterone will do. And we could use that for men too. It does not necessarily just younger men as well. It can be older men, it's fine. Thyroid optimization, because thyroid is such a master metabolic hormone. We address it alongside sex hormones when indicated. So we can use T4 only. We can use a combo of T4, T3, or we can carefully select compounded preparations based on your labs and symptoms. The goal is really not just normal range, but restoring your optimal energy, metabolism, and cognitive function. So we could do targeted supplementation. So we use professional grade third-party tested supplements from trusted brands like Orthomolecular or Biote. We have pure encapsulations here as well. And this we can do this to basically correct key nutrient deficiencies and support hormone detoxification pathways and optimize thyroid, adrenal glands, cortisol, things like that. And then since hormones are dynamic and it's not a one-time set it and forget it fix, we obviously have to follow your labs, symptoms over time. We adjust your dosing based off your body and how it's reacting. We look at everything, the lifestyles, things like that. Maybe one modality will work and we switch to another one because that works better. It depends. You have to be followed. And then testosterone can raise your blood levels, so we also need to follow you for that. Okay, so bioidentical versus compounding. So I had mentioned in there bioidentical, and then we use some compounding pharmacies too. Let me explain here. So bioidentical describes the actual structure of a hormone molecule. It means the hormone is chemically identical to what your body naturally produces. It looks like this. I'm going to make it like this, okay? Non-bioidentical hormones have a little bit different molecular structure and do not mimic your body's natural hormone exactly. So it looks like this or it looks like that, right? Still works, but isn't perfect. Compounded describes the manufacturing process. A compounding pharmacist custom mixes a hormone formulation based on a specific prescription from us or any physician or NP. There's many FDA-approved bioidentical hormones that you can pick up at any standard retail pharmacy. For example, the estradiol patch or oral micronized progesterone capsules, those are bioidentical, and those you can actually sometimes get approved for insurance. And those that are custom compounded are not, insurance does not usually cover those. And often we use those because we can't find the right modality in a FDA-approved normal pharmacy. But not all compounded pharmacies are created equal. And so we only partner with pharmacies that we trust and those that follow their own FDA compounding guidelines and can provide us with appropriate potency and sterility testing. So if you go to a compounded pharmacy, you want to make sure that you know where you're getting it, where they're getting it. All right, pellet therapy. We do a lot of Biote pellet therapy for women and men. It really, in my experience, I've seen the best outcomes for women with pellet therapy, and why our patients prefer this route often over daily patches, creams, and needles. So Biote pellet, this is like, you'll see on the screen, those are little like rice pellets. They're not rice, but it's a pellet. Custom dosed compounded hormones that are inserted under the skin. They're usually in like your buttock a little bit, like the side hip area, or sometimes in men will put it in their flank because they tend to have like their pocket full of money or their wallet in their buttock. And so you don't want to irritate that. But it's inserted right underneath the skin layer into the little fat layer. And then it just stays there. It's actually a fairly painless procedure because we numb you. And most people are like, I didn't even feel it. The worst part was the numbing. And it's done literally probably in 5 minutes. It's a pretty easy procedure in office, but we do those here. Pellets last for 4 to 6 months. So you only need them implanted 2 to 4 times a year, which is nice. And there's no daily creams or gels or accidentally transfer something to a child or pet, no weekly needles. You don't have to poke yourself 50 times. And no dramatic roller coasters of those hormone spikes and crashes when you're doing the needles or the injections. They are long acting. Okay, let's talk about a little myth busting. So before we move on to lifestyle tips, I want to address some of the major myths and headlines that cause unnecessary fear around hormonal health. So myth number 1, hormones cause cancer. So the biggest one was estrogen replacement therapy causes cancer. This fear stems almost entirely from a single study published in 2002 called the Women's Health Initiative, or the WHI. So when the study came out, the media ran sensationalized headlines that caused a massive wave of panic. Millions of women immediately threw their hormones in the trash and went back to suffering in silence. But let's look at what the actual 20-year long-term follow-up data from that trial shows. It is a story that is almost never told. First, estrogen alone actually protects. In the WHI trial, women who had undergone a hysterectomy and took estrogen alone did not have an increased risk. In fact, they experienced a 22% decrease in breast cancer incidence and 40% decrease in breast cancer mortality over 20 years. So let that sink in. Pure estrogen was actually protective for the breast. Second, the progesterone partner matters most. The slight increase in breast cancer risk seen in the WHI trial was entirely confined to the group taking estrogen combined with synthetic progestin called medroxyprogesterone acetate. Third, so we now have bioidentical alternatives. In Europe, a massive trial of over 54,000 women called the E3N study evaluated women taking estrogen combined with structurally bioidentical micronized progesterone, which is the exact natural molecule we prescribe here at SomaVie. The result was that micronized progesterone was associated with a highly favorable lower risk profile compared to synthetic progesterones like the MPA, which carried an elevated risk of 1.4. Finally, let's put the absolute risk of that synthetic combination in perspective. Even for the women taking the synthetic progestin in the trial, the risk amounted to fewer than one additional breast cancer case per 1,000 women per year of use. In clinical medicine, we class that as an extremely low risk, identical in magnitude to having 2 alcohol drinks a day on average, being obese, or being physically inactive. With those 3 things, alcohol, obesity, and physically inactive, you carry the same risk as this trial's cancer risk. So when someone tells you hormones cause cancer, the honest clinical answer is it depends entirely on which hormone, which combination, and how you deliver it. And on top of that, which is not in here, the women who were at higher risk received those hormones later in the trial, not younger, immediately the 50, like at menopause. All right. Myth number 2, testosterone causes heart attacks. So this headline made rounds years ago, but large-scale, high-quality safety trials have simply not supported this claim. In fact, optimizing testosterone in clinically deficient patients is actually vital for metabolic and cardiovascular support. Okay, myth number 3, it's just aging. Okay, I hear this like literally all the time. Every new patient that comes to me, that's usually how I end up with patients, because they come to me and I look at their blood work and I'm like, no, this is not correct. This is not your blood. It's not just aging, and you do have some abnormalities. So they think their fatigue or weight gain is inevitable part of getting older. But as we've discussed, lifestyle factors such as metabolic health, fat around your organs, sleep architecture, stress, those often play a much larger role in your levels than just age alone. So we can optimize these factors, which is very nice. All right, so balance tips here for food, sleep, and stress. So let's talk about the foundational habits that you can start practicing tonight. These are the core lifestyle pillars of hormone balance. First is food. If you want to support your hormone production, you must prioritize protein throughout your entire day. Protein provides the essential amino acids your body needs to build hormones and preserve lean muscle mass. Additionally, if you want to heavily favor whole foods over ultra-processed foods, which contain those inflammatory seed oils and synthetic additives that disrupt endocrine function, then you're going to be better off. Second is sleep. So yes, you have to aim for 7 hours of sleep. High quality sleep, that's another one. And sleep is when your brain detoxifies and your endocrine system resets. So research shows that even a few short nights of poor sleep can measurably and negatively shift your insulin, cortisol, and sex hormone levels. So third is your stress management. Easier said than done, I know. So chronically elevated cortisol acts as an active blocker for your sex hormones and thyroid. So you've got to find daily consistent practices to signal safety to your nervous system, whether that's yoga, Pilates, working out, whatever works for you. A walk in nature, stuff like that. So as a thank you for attending today, we are going to email all of you an in-depth comprehensive guide for healthy hormone habits that details exactly how to implement these changes. All right, movement and environment. Our next two lifestyle pillars are movement and our chemical environment. Movement, when it comes to hormones, cardiovascular exercise is great, but resistance training is actually 100 times better. So lifting weights or doing body weight resistance training pairs directly with your protein intake to protect your muscle mass and keep your metabolic rate high as you age. Muscle is literally the organ of longevity. The environment, so when we actively reduce our daily exposure to these endocrine disrupting chemicals, so like if you have Tupperware, switch to like a glass Tupperware, right? Do the best you can. So the easiest place to start are with your food storage, which I just talked about. And then your personal hair care products. Swap plastic food containers for glass or stainless steel, and then stop heating your food in plastic. Don't put it like in the microwave with like a Ziploc bag. Put it on a plate or put it in a glass container. You want to try to choose fragrance-free, clean products around the house. There's a lot of detergents that are fragrance-free, free and clear. Those all contribute. So you don't have to do a major overhaul life overnight. Just make small little consistent changes so that you can get rid of some of these endocrine disruptors. All righty. So now if you're listening and you're thinking, okay, I'm ready to stop guessing. I want to start knowing. I want to partner with a team that looks at my whole picture. We've put together 3 offers for you guys. They're curated packages specifically for our webinar attendees and anybody who will be listening to this, watching this webinar in the next couple of days. Okay, so we have a basic hormone foundation. If you are not near us or you just want to know what your labs are saying, we will order these labs for you. If you're in Indiana, we will order these labs for you and we will review them and send you an email with a review sheet of what we think your next steps are. So normally that's a $335 value and we're going to do it tonight for $299. We have our advanced hormone foundation. This is more for our in-person, or you could also do a telehealth with us. It's a provider hormone mini consult. You get an advanced hormone and metabolic panel. So not only we're going to look at your hormones, your testosterone, your testosterone, your thyroid, vitamins, your blood levels. We're also going to look at insulin. We're going to look at cortisol. We're going to look at a couple inflammatory labs. So this full hormone and metabolic panel is $587. And then we're going to review that as well. And then if you are here, ideally you get those labs drawn here. And so that normally is $882, and we're going to offer that for $649. And then if you want a complete overhaul of your metabolic and hormone evaluation, you're going to get all that is in the number 2, but we're also going to do the Dutch test, which is that dried urine test that looks at like all the metabolites. How do I get rid of these hormones? Do they go over here? Do they go over here? You know, if I test my cortisol in the blood here in the morning, is it going up like it should be and then going down, or is it just staying like that? The Dutch test is awesome for those little metabolites and testing your complete hormone panel with your serum and your blood. Then I'm also going to send you to get a resting metabolic rate test. So that'll tell me what your actual metabolism is instead of just calculating it. So whether you have a slow metabolism, a fast metabolism, and then you'll have a body composition scan. So we'll put you on the Seca. We have a similar to like an InBody, but better, more precise. Then we will do a Seca scan. We'll look at your resting metabolic rate. We'll do that Dutch test to get more in-depth value for your hormones. We are going to put together, spend time with you and do an in-depth provider consult to really go through not only just hormones, but metabolism and some weight. Okay. So that normally is $1,740, and we're going to do that for $1,249 for you guys tonight. Thank you so much for joining. This will be available tomorrow, correct, Lucy? All right. Yes. We are going to send you guys a couple extra tidbits probably tomorrow for joining. Thank you so much. And when this comes out, share it with your friends, and feel free to contact the office if you want to know more or if you have any questions. Thank you. And we're located at Keystone at the Crossing.